Have you ever wondered about the hidden challenges faced by old age homes and how they impact the lives of our elderly loved ones? In this video, we'll delve into the critical issues affecting these vital institutions, from financial constraints and healthcare challenges to social isolation and concerns of neglect. By the end, you'll gain a deeper understanding of the real struggles within old age homes and why it's crucial to address these problems. Stay with us to learn how we can work together to create better care environments for our seniors and ensure their well-being is prioritized. Before we begin, I would appreciate it if you like this video. You can help me continue to spread the old age lesson. If you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. If you like this video, please comment number 1. If you don't like it, comment number 0 to let me know so I can make a better video for you. Now let's get started. Some of the major problems faced by old age homes are: 1. Financial constraints. One of the most pressing challenges that old age homes face is the persistent issue of financial constraints. The financial strain on these facilities is a multifaceted problem that significantly impacts their ability to deliver high-quality care and services to residents. Operating an old age home requires substantial financial investment, not just for the basic needs of the residents, but for maintaining a nurturing, safe, and supportive environment. Firstly, the cost of providing quality care is considerable. This includes hiring and retaining skilled healthcare professionals such as nurses, caregivers, and medical staff. In many cases, old age homes struggle with budgetary limitations that force them to operate with reduced staff, leading to a higher workload for existing employees. This can result in increased stress, burnout, and decreased quality of care, as staff members are stretched thin trying to meet the diverse needs of residents. In addition to staffing issues, the financial constraints also impact the infrastructure of these homes. Many facilities are unable to invest in necessary upgrades or repairs, leading to outdated and sometimes unsafe living conditions. This lack of investment can affect everything from basic amenities to safety features, creating an environment that might not fully meet the needs of aging residents. For instance, the inability to maintain or improve accessibility features, such as ramps or handrails, can compromise the safety and comfort of residents with mobility issues. The financial limitations extend to the provision of amenities and activities that are essential for the well-being of elderly residents. Engaging activities, recreational programs, and therapeutic services are crucial for maintaining mental and emotional health, but these programs often require additional funding. When budgets are tight, these valuable programs are among the first to be cut, leading to a more monotonous and less stimulating environment for the residents. Moreover, the cost of medical supplies and medications adds another layer of financial burden. Many old age homes struggle with the rising costs of pharmaceuticals and medical equipment, which can result in shortages or delays in necessary care. This not only impacts the health outcomes of the residents, but can also lead to a sense of frustration and helplessness among both staff and residents. In summary, financial constraints present a significant obstacle for old age homes, affecting every aspect of their operation. From staffing shortages and infrastructure deficiencies to the inability to provide engaging activities and necessary medical supplies, the impact of financial limitations is far-reaching. Addressing these challenges requires a concerted effort from government bodies, private organizations, and the community to ensure that old age homes can offer the high standard of care and quality of life that every senior resident deserves. 2. Healthcare challenges. Elderly residents in care facilities frequently encounter a myriad of complex healthcare needs that require specialized and nuanced medical attention. As individuals age, they often face a range of chronic conditions such as diabetes, hypertension, cardiovascular diseases, and arthritis, alongside potential cognitive impairments like dementia and Alzheimer's disease. These conditions necessitate ongoing and meticulous medical management to ensure optimal health and quality of life. Unfortunately, many old age homes, despite their best intentions, struggle to meet these specialized healthcare needs adequately. One of the primary issues is the lack of essential medical equipment and advanced technology. The absence of up-to-date diagnostic tools, monitoring devices, and treatment technologies can severely impede the ability to provide timely and effective care. For instance, without advanced monitoring systems, caregivers may be unable to track vital signs accurately or respond quickly to changes in a resident's health status, leading to delays in treatment and potential complications. Additionally, the shortage of well-trained medical and healthcare staff further exacerbates the problem. Many facilities find it challenging to recruit and retain healthcare professionals who possess the specialized skills required to manage the intricate health issues common among the elderly. This gap often results in a reliance on generalist staff who may lack the expertise needed to address specific medical conditions or to provide the level of care necessary for managing complex health scenarios. Moreover, the lack of comprehensive healthcare solutions within these institutions means that residents might not receive the continuity of care required for managing chronic conditions effectively. Regular assessments, personalized treatment plans, and preventive care are crucial for maintaining health and preventing the progression of diseases. When these services are not available, seniors may face increased hospitalizations, deteriorating health conditions, and a diminished quality of life. In summary, the challenges faced by old age homes in providing adequate health care are multifaceted and significant. Addressing these challenges requires a concerted effort to improve medical infrastructure, invest in advanced technology, and ensure that facilities are staffed with skilled professionals capable of meeting the complex needs of their elderly residents. Only then can we ensure that seniors receive the comprehensive, compassionate, and competent care they deserve. If you are still watching this video and finding these lessons useful, please comment number 1 below to let me know that you are still watching this video with me. Thank you for your valuable time. 3. Understanding particular illnesses. In our current healthcare landscape, there exists a significant gap in the understanding and management of specific illnesses that predominantly affect elderly residents. This gap is particularly pronounced when it comes to mental health concerns, which are frequently overlooked despite their critical importance. As our population ages, we are facing an increasing prevalence of conditions such as dementia, depression, and Alzheimer's disease among seniors. These issues are not just numbers and statistics, but real, debilitating conditions that deeply impact the quality of life for many elderly individuals and their families. The rise in dementia, depression, and Alzheimer's disease among the senior population represents a pressing challenge. Dementia, encompassing a range of disorders that affect memory, thinking, and social abilities, is increasingly common as people live longer. Alzheimer's disease, the most prevalent form of dementia, leads to severe cognitive decline and has become a major public health concern. Depression, often underdiagnosed and undertreated in older adults, can exacerbate other health problems and diminish overall well-being. One of the major problems is the lack of adequate facilities and specialized care and senior home care services. Despite being located in large metropolitan areas with access to advanced healthcare infrastructure, many senior care facilities are not equipped to handle the complexities of geriatric mental health issues. This shortfall is evident in the insufficient training of staff in recognizing and managing mental health conditions, and in the limited availability of specialized programs designed to support seniors with these conditions. Furthermore, there is a systemic issue in addressing these mental health challenges. The healthcare system often fails to integrate mental health services into routine senior care, resulting in fragmented and inadequate treatment. This lack of integration contributes to the difficulty in managing chronic illnesses and hinders the provision of comprehensive care. To address these issues, a multifaceted approach is needed. This includes increasing awareness and education about mental health in the elderly, enhancing training for healthcare providers, and expanding specialized services within senior care facilities. Additionally, there must be a concerted effort to advocate for and implement policies that support the integration of mental health services into general geriatric care, ensuring that seniors receive the comprehensive care they deserve. In summary, understanding and managing particular illnesses affecting the elderly, especially mental health conditions, is crucial. The current deficiencies in care and the growing prevalence of these issues highlight the urgent need for improved resources, education, and systemic changes to better support the aging population. 4. Social isolation. Even though seniors in old age homes are often surrounded by other residents and staff, they can experience profound feelings of loneliness and isolation. This emotional disconnect is not merely a result of physical separation from loved ones, but is deeply rooted in the lack of meaningful, personal interactions that fulfill their emotional and psychological needs. The social environment within these homes can sometimes be lacking in genuine, heartfelt connections, leading to a sense of estrangement among residents. The impact of this isolation extends beyond mere feelings of loneliness. It significantly affects mental health. Seniors experiencing social isolation are at a higher risk for developing mental health issues such as depression, anxiety, and even cognitive decline. The absence of regular, enriching social interactions can exacerbate these conditions, making it essential to address the root causes of isolation. Family members, who might live far away or have busy lives, often struggle to maintain frequent contact, which further compounds the sense of disconnection for many seniors. Without regular visits or personal connections, the emotional and psychological support that the family typically provides becomes less accessible. To counteract the negative effects of social isolation, it is crucial for old age homes to foster a supportive and engaging social environment. This can be achieved through various means, such as organizing regular social activities, encouraging resident participation in group events, and creating opportunities for residents to form meaningful friendships. Additionally, implementing programs that facilitate communication with family members, even from a distance, can help bridge the gap between seniors and their loved ones. By addressing these aspects, old age homes can significantly improve the quality of life for their residents, reducing feelings of loneliness and enhancing overall mental well-being. If you are still watching this video and finding these lessons useful, please comment number 2 below to let me know that you are still watching this video with me. Thank you for your valuable time. 5. Ageism and the loss of meaning. Ageism, characterized by outdated and discriminatory beliefs about the elderly, plays a significant role in the marginalization and isolation of senior citizens within many communities. These misconceptions not only contribute to a negative perception of aging, but also undermine the value and dignity of older individuals, resulting in their exclusion from social, economic, and cultural spheres. One of the most pervasive issues stemming from ageism is the loss of meaning and purpose experienced by many elderly individuals. When society holds limiting views about aging, such as the belief that older adults are less capable, less relevant, or less valuable, it can lead to a diminished sense of self-worth among seniors. This marginalization often manifests in the form of reduced opportunities for participation in social and community activities, reinforcing feelings of isolation and invisibility. To combat these negative effects and restore a sense of purpose and identity to senior citizens, it is crucial to develop and promote innovative ways to include them in social events and activities. Actively involving older adults in community life not only enhances their sense of belonging but also taps into their vast reservoir of knowledge and experience. Seniors have lived through diverse experiences and possess invaluable insights that can contribute significantly to the advancement of society. For instance, incorporating seniors into community discussions, decision-making processes, and cultural events can help bridge generational gaps and foster mutual understanding. Programs that encourage intergenerational interactions, such as mentorship opportunities, collaborative projects, and shared learning experiences, can highlight the unique contributions of older adults while providing them with a renewed sense of purpose. Additionally, celebrating the achievements and wisdom of elderly individuals through public recognition and storytelling can help shift societal attitudes and combat ageist stereotypes. By showcasing the accomplishments and life lessons of seniors, communities can challenge outdated perceptions and affirm the value of aging. Creating environments where seniors are actively engaged and valued not only enhances their quality of life, but also enriches the community as a whole. Embracing the diversity of experiences and perspectives that older adults bring to the table can lead to more inclusive, innovative, and compassionate societies. In summary, addressing ageism and fostering meaningful inclusion of senior citizens requires a concerted effort to challenge outdated stereotypes and create opportunities for active participation. By recognizing and celebrating the contributions of older adults, we can help ensure that they remain a vital and respected part of the community, ultimately enriching the lives of everyone involved. 6. Neglect and abuse. A deeply troubling issue that affects some old age homes is the occurrence of neglect, abuse, or mistreatment of residents. This serious problem can have devastating consequences for the elderly individuals who rely on these facilities for their care and well-being. Several factors contribute to the prevalence of neglect and abuse in care settings. Understaffing is a significant issue. Many facilities operate with fewer caregivers than needed to provide adequate attention and support to each resident. This shortage can lead to overworked staff who are unable to give each resident the time and care they require. As a result, basic needs such as personal hygiene, medical attention, and emotional support may be inadequately met, leading to neglect. Poor management practices can also exacerbate these problems. When leadership fails to establish and enforce clear policies for care standards, or when there is a lack of oversight, the potential for neglect and abuse increases. Inadequate administrative support can lead to a lack of accountability, insufficient grievance mechanisms for residents and their families, and an overall decline in care quality. Furthermore, inadequate staff training plays a crucial role in these issues. Staff members who are not properly trained may not be equipped to handle the unique needs of elderly residents, including those with cognitive impairments or complex medical conditions. This lack of preparation can result in unintentional neglect or even abusive behavior, as staff may struggle to manage challenging situations effectively. Additionally, without proper training in recognizing and reporting signs of abuse or neglect, staff may fail to take necessary actions to protect residents. The presence of neglect and abuse in old age homes is a grave concern that calls for urgent attention and action. Addressing this challenge involves implementing rigorous staff training programs, ensuring adequate staffing levels, and fostering a culture of transparency and accountability within care facilities. It is also essential to establish and maintain robust systems for reporting and investigating complaints, ensuring that residents and their families have a clear and safe way to voice concerns. In summary, the issue of neglect and abuse in old age homes is complex and multifaceted. Recognizing and addressing the underlying factors contributing to these problems is crucial for safeguarding the well-being and dignity of the elderly population. Through comprehensive strategies that include improved staffing, effective management, and enhanced training, we can work toward creating safer and more supportive environments for all residents. 7. Loss of autonomy. One of the most significant concerns among seniors residing in old age homes is the perceived loss of independence and autonomy. This issue is multifaceted and deeply impacts the overall well-being and quality of life of elderly residents. As individuals transition into care facilities, they often face a range of restrictions that can significantly diminish their sense of control over their daily lives. These limitations may encompass various aspects of daily living, including routines, meal choices, and social interactions. Daily routines in many old age homes are structured to ensure safety and efficiency. However, this structured environment can sometimes lead to a feeling of disempowerment among residents. For instance, rigid schedules for meals and activities, while designed to provide consistency, may conflict with the personal preferences and established habits of individuals. This clash can foster feelings of helplessness as residents find themselves unable to make decisions about their own daily lives. Meal choices are another area where autonomy can be compromised. While dietary restrictions and health considerations necessitate some level of control, the inability to choose or modify one's meals can contribute to a sense of loss. Food plays a significant role in personal enjoyment and cultural identity, and limited options can lead to dissatisfaction and a diminished quality of life. Social interactions are equally important. The constraints imposed by facility policies, physical limitations, and scheduled activities can limit residents' opportunities to engage with others on their terms. This restriction can lead to isolation and loneliness, exacerbating feelings of frustration and disempowerment. Striking a balance between providing necessary care and preserving autonomy is crucial for creating a positive and empowering living environment in old age homes. This balance requires a thoughtful approach that respects the individual preferences and needs of residents while ensuring their safety and well-being. It involves personalized care plans, developing care plans that consider individual preferences and routines, where feasible, can help maintain a sense of autonomy. This includes allowing flexibility in daily schedules and meal choices whenever possible. Resident involvement, encouraging residents to participate in decision-making processes regarding their care and daily activities fosters a sense of ownership and control. Involving them in discussions about their care and choices helps them feel valued and respected. Empowerment through choice, providing options within the constraints of health and safety considerations, allows residents to exercise choice and control. This can include offering a variety of meal options, activity choices, and opportunities for personal engagement. Enhanced communication, maintaining open lines of communication between staff and residents is essential. Understanding and addressing residents' concerns and preferences can lead to more responsive and person-centered care. Supportive environment, creating an environment that encourages independence, such as accessible facilities and adaptive tools, supports residents in maintaining as much autonomy as possible. By prioritizing these strategies, old age homes can better balance the need for care with the imperative to preserve and promote the autonomy of their residents. This balance not only improves the overall experience for seniors, but also contributes to their dignity, self-esteem, and emotional well-being. If you are still watching this video and finding these lessons useful, please comment number 3 below to let me know that you are still watching this video with me. Thank you for your valuable time. 8. Accessibility challenges. Old age homes often face significant challenges in accommodating the diverse needs of seniors with mobility or sensory impairments. These accessibility issues can profoundly affect residents' safety, comfort, and overall well-being. Without essential features designed to meet these needs, the risk of accidents and injuries increases, further jeopardizing the health and quality of life of those living in these facilities. For residents with mobility impairments, the lack of appropriate features such as ramps, elevators, and accessible bathrooms can lead to difficulties in moving around safely. Narrow hallways, uneven floors, and inadequate handrails can contribute to falls and other accidents, which may result in serious injuries and exacerbate existing health conditions. Similarly, for individuals with sensory impairments, the absence of modifications such as visual and auditory aids can hinder their ability to navigate and interact within the facility. For instance, insufficient lighting, unclear signage, or the lack of hearing assistance devices can make it challenging for those with visual or hearing impairments to participate fully in daily activities and communicate effectively. Addressing these accessibility challenges requires more than just physical modifications. It involves a comprehensive approach to creating an inclusive environment that considers the diverse needs of the elderly population. This includes physical modifications, installing ramps, elevators, accessible restrooms, and handrails, as well as ensuring smooth, non-slip flooring to facilitate safe mobility for all residents. Sensory aids, implementing visual and auditory enhancements, such as improved lighting, clear signage with large fonts, and hearing assistance systems to support those with sensory impairments. Training and awareness, educating staff and caregivers about the specific needs of residents with impairments to ensure they provide appropriate support and assistance. Feedback mechanisms, creating channels for residents and their families to provide feedback on accessibility issues and suggest improvements, ensuring that the facility evolves to meet their needs effectively. By addressing these aspects, old age homes can enhance the safety, comfort, and quality of life for all residents, creating a more supportive and inclusive environment that respects and accommodates their diverse needs. Conclusion. Old age homes are vital institutions that offer a refuge for seniors who may not have family support or require specialized care that exceeds what can be provided at home. These facilities play a critical role in ensuring that elderly individuals receive the necessary attention and support as they navigate the complexities of aging. However, the challenges confronting old age homes are both multifaceted and significant. Financial constraints are a prominent issue, with many facilities struggling to secure adequate funding to maintain high standards of care and infrastructure. Healthcare obstacles also present considerable challenges, as providing comprehensive medical services and addressing the diverse health needs of seniors requires substantial resources and expertise. Social isolation is another pressing concern, with many elderly residents experiencing feelings of loneliness and disconnection from the wider community. This isolation can be exacerbated by inadequate social and recreational activities within the facility. Moreover, there are ongoing worries about the potential for neglect and abuse, which can undermine the trust and safety of residents. The loss of autonomy is another critical issue, as seniors may feel their independence diminishing, leading to diminished quality of life and mental well-being. Accessibility issues, including physical barriers and inadequate transportation options, further complicate the situation, making it difficult for seniors to engage fully with their surroundings and maintain meaningful connections. Addressing these complex problems is essential for old age homes to fulfill their mission of providing a safe, supportive, and enriching environment for elderly individuals. It is crucial to recognize and tackle these challenges through comprehensive strategies and investments. As our society continues to age, the importance of improving the quality of life for seniors both within old age homes and in the broader community becomes increasingly clear. Ensuring that these facilities are equipped to meet the evolving needs of our elderly population will help create a more compassionate and supportive environment for all. Thank you for joining us in exploring the vital issues faced by old age homes and the challenges they encounter. We hope this video has shed light on the complex realities of elder care and inspired you to think about how we can all contribute to improving these environments. What have you learned so far? We'd love to hear from you. Please comment below on one thing you've learned and how you plan to apply it in your life. If you liked this video, please leave your comment below and don't forget to like, share, and subscribe to our YouTube channel for more content like this. Your support helps us continue to provide valuable insights and information. Thank you for watching.